really happy that we're doing this forum, and hopefully we're going to try to dispel some of that misinformation. We have two wonderful presentations. I'm going to start with Dr. Jamie Morano. She is going to be talking to us about how vaccines work. Dr. Morano has a joint appointment as Associate Professor at the University of South Florida, Division of Infectious Diseases and International Medicine at the Morsani College of Medicine and the USF College of Public Health. She served as a principal investigator in the Vaccine Link Project, which was a joint USF Florida DOH grant initiative that sponsored community health navigators to identify barriers to vaccination and link individuals to vaccination. She currently serves as a medical director of disease control at the Florida Department of Health, Hillsborough, where she advises on vaccination within the Ryan White Specialty Care Center. She completed internal medicine residency at Dartmouth Hitchcock Medical Center, infectious disease fellowship at Yale University School of Medicine, and public health and statistical training at the Harvard School of Public Health.
And thank you, Joe, for that wonderful introduction, and thank you to our hosts for having us here. I'd like to start off, just a second, talking to you all about the power to protect, and my role here is to facilitate the Department of Health messaging of vaccination, but also know that I'm affiliated with the Department of Health, but I'm not a direct employee, so what I'm saying has been approved, but it is not my direct opinion. It is what I believe, but it is not the actual Department of Health in terms of messaging. Let's start here. I'm going to go like this for the next slide. Right, so today I'd like to talk about the power to protect is yours. And this is a very exciting campaign adopted by the Florida Department of Health to really reach individuals through a positive media campaign surrounding vaccination. Next slide, please. We're targeting all individuals for vaccination, birth to older age, and really trying to promote vaccination, but also dispel myths surrounding vaccination. Our session aims today is to talk about vaccine preventable diseases, vaccine safety and development, addressing vaccine concerns, and how you can prevent disease within yourself and within your community. Many of you have probably reading the newspapers and hearing on the radio about measles outbreaks. So far this year, there have been 839 cases in the United States of measles. Certainly many people are becoming alarmed and frightened by those numbers. We're here to allay those fears and also break that down a little bit in terms of what you can do to prevent disease. The next slide is from the CDC. It's showing the areas that we do have measles activity, mostly the activities in the Northeast and the Pacific Northwest, where there are clusters of people who have not been vaccinated. Next slide. Florida, thankfully to its good campaigns and good programs, has only seen 2 total cases, and these have been imported cases. So we're not seeing an internal transmission of measles that I'm aware of in Florida, thanks to the good efforts of folks with back-to-school campaigns all throughout the state. These are the Florida measles cases from 2013 to 2019. You can see that overall measles cases have decreased, again to attribute to vaccination and also contact tracing appropriately. For the public in the audience, I just wanted to touch upon how to recognize measles. Many people recognize measles as a rash. However, it is much more than a rash. Measles can cause pneumonia and, most importantly, encephalitis.